My name is Jullia Rosdahl, and I'm one of the glaucoma specialists at the Duke Eye Center. With glaucoma, it has to be a partnership between them, the patient, and myself. The patient needs to trust me with what I'm telling them about their eyes, since a lot of times in glaucoma they don't have any symptoms, and so they're trusting me about what treatments they need. And then I have to trust them to do what I've asked them to do with their drops or their surgery, and trust them to come back to me if they're having a problem so that we can take care of things. So I think it's establishing a trusting partnership with the patient. I'm interested in patient education for glaucoma. Like I had mentioned, I think that partnership between the doctor and the patient is so important for glaucoma, since taking drops and controlling the pressure is the most important way to prevent glaucoma blindness. So my research is really in the area of how to educate patients about their disease and help them to take the best care of themselves. When I started medical school, I had no idea what ophthalmology was and no idea what glaucoma was. I went into medicine like most people because I wanted to help people. And I did a MD, PhD combined program, and so I actually went into the lab early on in my training, and that's where I first learned about ophthalmology. My PhD project was in the visual system, so I learned about the eye, and I studied retinal ganglion cells, and those are the cells that die in glaucoma. And so after my PhD, I went back into medical school, chose the specialty of ophthalmology because I fell in love with the eye, and then glaucoma is a disease where you're trying to save those retinal ganglion cells that I had fallen in love with during my research.